Okay, how can we treat and prevent these reactions? First of all, the most common way is just to avoid the allergen. If you're allergic to it, try to stay away from it. We can also use drugs to block the action of the lymphocytes and the mast cells and those chemical mediators. These drugs are called antihistamines. And we can also use desensitization or hyposensitization therapy, where we inject the allergens and that stimulates you producing more of this allergen specific IgG to keep the IgE allergen from binding in the mast cells. A lot of people talk about taking allergy shots. That's what they're doing, the desensitization. That word's difficult. We can block. This is an example of the blocking antibody theory, where you block it so that the antigen or the allergen can't bind with the mast cell. So which of the following are considered major chemical mediators of type 1 allergens? And that would be all of the above. And continuing on, we're going to talk about type 2 hypersensitivities. And this is going to be reactions that cause foreign cells to lyse. And this would involve your antibodies. And it's also shown when you have transfusion reactions, when you get the wrong blood type in your ABO blood groups. It's also shown when you have a reaction because of the Rh factor in your blood that causes the hemolytic disease of the newborn. Now, to review briefly our ABO blood groups, they are determined by the glycoproteins on the red blood cells, and they're inherited. And you get two alleles for A, B, or O. And so you've got four blood types: type A, type B, type AB, or type O. And you name them for the dominant antigen. So A has A as the dominant antigen. B has B as the dominant antigen. O doesn't have any antigens. And if it has A and B, it's going to be type AB. And you can have other tissues besides your blood that carry these A and B antigens. This is a chart that shows the genotypes and the antigen that's present, the antibody, what percentage in the United States among white people have this type blood, what percentage among Asians in the United States have this type, and what percentage among African Caribbean descent have this blood type in the United States. So looking at that, you can see that type O is the most dominant, whereas type AB is the least common. Now, there are preformed antibodies that are also going to be in your blood, in the plasma, and they will cause agglutination of your red blood cells because the antigen interacts with the antibodies. So type A reacts against B antigens, and B reacts against A antigens. O reacts against both A and B, and AB doesn't react. That's why it's considered the universal recipient. And this is just a graphic showing the red blood cells and their shape, and you can see well, I'm not going to explain it. You can see that A has the A antigen, and B has the B antigen, and AB has A and B, and O doesn't have any on its red blood cells. Now, these transfusion reactions, you can see here we've used the antiserums, type A blood there. We can recognize that because it agglutinated in type A, and so it's type A blood. B agglutinated in B, so it's type B. AB agglutinated in both of them, and O has no antigen, so it doesn't agglutinate at all. And when the transfusion reaction happens, basically just causes the red blood cells to kind of fall apart, and these these um, complement proteins will cause this membrane attack complex to attack those red blood cells, and so they just kind of fall apart, and we call that agglutination. Now, the hemolytic disease of the newborn is because of the Rh antigen. And people that are Rh positive have the antigen, or yes, have the antigen. People that are negative do not have it. So if you've got a mother that's Rh negative and the father is positive and the baby turns out to be positive, those fetal blood cells can leak into the mother's circulation during childbirth. And so that sensitizes her immune system. Now, the first child's born, no problem, but the second child that she has that is positive, her anti-Rh antibodies will attack the baby's red blood cells and cause them to lyse. So you're going to have this massive immunization of the mother with antibodies against that Rh antigen to keep her from being sensitized. So you can see here, figure A over on the left, that's a negative mother and a positive baby. Okay, when that baby is born and the placenta breaks away, some of the baby's red blood cells will go into the mother's. Okay? So you've got this second pregnancy with a positive child. Mother's making these antibodies now, those little Y-shaped green things. So they cross the placenta and attack the baby's red blood cell. But the first child is not affected. And that RhoGAM up there, that injection she's getting, that's that massive dose of the antibodies to keep her from becoming sensitized, so that it won't, each pregnancy is considered like the first one. And this happens with pregnancies, with abortions, and with miscarriages and dead births, stillborns.